Hello, 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 and welcome to yet another episode of the Anxiety RX podcast. I am your host, Dr. Russell Kennedy, a doctor and clinical neuroscientist who himself suffered from severe anxiety as a result of growing up with a father with schizophrenia and bipolar disease. So today on the podcast, I have a very special guest, Dr. Helen Sairany, and I hope I said your name right. And Helen is a war survivor. And I find her story really interesting. So I'm just going to read her bio here. As a 7-year-old Kurdish child in Iraq, a country torn by war and conflict, I was spotted by a U.S. Marine deployed to my country with a grenade in my hand, who saved my life by exchanging the grenade for a bag of candy. Because of my turbulent childhood, I was diagnosed with complex PTSD in 2013. Thus, I aspire to live in a world where the vast majority are trauma-informed, feel psychologically safe and valued for the work they put out, and return home fulfilled. So, Helene, thank you for being on the podcast.
Thank you so much for having me. Really excited to have a conversation with you today.
Yeah, did you want to talk a little bit about that whole, because that's a pretty big deal. I don't think I've had too many war survivors here on the Anxiety RX podcast. So if you want to just sort of give us a little background into that, because we were talking before and it was quite riveting, actually.
So war is a racket. It rips you off from the most beautiful things in your life, and I like to talk about this in the context of this whole concept of diversity, equity, and inclusion, because time and again I tell people that letter T, big trauma, needs to be included in DEI, because if you look at any member of minority, I guarantee you they will have couple ACEs, the adverse childhood experiences in their
Sure.
life. Now, why do I say that? As someone who had to escape a place that I used to call home, not at a fault of my own, not a choice, it was very, very traumatic for me. At an age where I was developing belonging as a child, I had to leave my loved ones behind. I had to leave my home behind. And I came to a country that was completely foreign to me. Now, as much as I love how Americans welcomed me with love, with gave me the safety, the home that I was yearning for, but it was not a place that Helen could be 100% herself.
Mm.
I came to this place with nightmares. I came to this place with lots of fear, with lots of triggers. I was terrified as a child. I didn't know how to speak the language. I mean, everybody was foreign to me. So it is something that I would love to emphasize, because when you tell me minority, I'll tell you trauma. When you tell me cultural sensitivity, I'll tell you culturally informed trauma. So you can't separate a trauma from minority. And an average minority comes to this country because their place of birth became the mouth of sharks.
Mm.
Because of war, because of bombing, because of torture, because of I don't know what. And we're seeing that every day. Talk about Gaza, talk about Ukraine, talk about Sudan, talk about Haiti. It's not a place that you can call home, because it has become so unsafe, so risky to stay, and you have no choice but to leave, to seek an alternative home that you could feel safe and start from scratch.
Yeah, I like to say that, when we're born, we learn that life is about connection or protection.
Yes.
So when we are raised in a securely attached environment with parents that love us and grandparents and connected, we learn that life is about connection and growth. But when we're raised in an environment where there's disconnection and fear, we're raised in this where that our nervous system gets forced into protection. So we get fixated on protection instead of connection. And as all anxiety is separation anxiety, being a minority is one of them. One of the things that I joke about is, like, I'm a middle-aged white, heterosexual doctor. There's not a whole lot of, there's not a, I tick all the non sort of minority boxes and that kind of stuff. And yet, growing up with a father with bipolar and schizophrenia, like the trauma doesn't escape any of us. But in an environment like that, it's just so horrendous.
Yeah.
That I think we all, we get into that thing where we sort of match our traumas up. It's like, well, I didn't have it as bad as them, or whatever. But I think one of the things I want to talk to you about before we started recording was, I think there's a lot more genetic information that's coming out now that our temperament is kind of genetically based. So what I mean by that is that our sensitivity to things is kind of genetically based. So my brother is more like happy-go-lucky, thick skin, whatever happens, happens. Me, I was always born the really sensitive one. So I always say, if you're
Yeah,
born with a sensitive disposition in a loving, caring environment, you'll do fine. If you're born with a sensitive disposition in a bad environment, and war is about the worst environment you can get into, it's going to be really hard for your nervous system to find any kind of safety to actually be able to create an autonomic nervous system that isn't on high alert all the time.
exactly. And as a child, you tend to, and as you're an expert in the area, as a child, with 90% of your brain being developed in the first 3 years, you tend to observe more than your brain is able to comprehend.
Mm-hmm.
So imagine observing torture. Imagine observing your loved one being fallen apart in front of you. It's too much. It's too much, and it follows you for the rest of your life. And I still struggle with nightmares, even though I take pride in this journey that I've taken on. But let me tell you, it's still, there are days where I still struggle, even though it happened when I was only 7. Yeah,
Well, when your nervous system gets forged in that kind of environment, I think we can create some structures and thing as you're an adult, but it really is sort of forged in that sort of protection
yeah,
realm. So you're always going to be kind of looking through the world with the eyes of protection.
yeah,
So I guess for you, like if I was quote unquote treating you, it's like I would say try and create as much safety as you possibly can. But there's probably a little part of you that's attracted to the chaos, that's attracted to the war, because you like, in a way, I put like in quotation marks, talking about it, because I think whatever was familiar to us in childhood
yeah.
becomes, Freud called it the repetition compulsion.
Yes,
So we
yes,
unconsciously repeat that in
yeah.
adulthood because we equate familiarity with this perverse sense of security.
Yes, yes. That is chemistry to Helen. I mean, you nailed it. You nailed it. That is exact chaos. Chaos is my definition for chemistry.
Mm.
That's exactly it, because it's a childhood familiarity, because that has become my baseline, as a child. So totally.
So when did you start, or did you ever? This is probably it. Did you ever feel safe growing up?
So I would say I was part of TED International in Vancouver, Canada, and I was interviewed because of my work in trauma. And one of the reporters told me, "What do you hope for?" And I told him my wish is to feel safe one day in my body.
Mm.
That is how egregious it is. There are times where I feel like I'm still that 7-year-old. So safety is something that I yearn for. I don't have it. I don't have it, and it doesn't take a lot for me to feel that fear. A fear of a 7-year-old in a body of 40-year-old, if that makes
Right.
sense. So
No, it
it
makes total
is.
sense.
It is very, very. It's exhausting. It expends so much energy out of me, and there are times where I'm not proud of myself. But then when I remember that of what I have gone through, I develop that compassion, because it's hard. It's hard. I'm like, why am I not feeling normal when my friends, when my colleagues, my acquaintances are all okay and I am not okay?
Well, they
When
may
they're not
not be
used to it.
okay, Helene.
Yeah,
They may not be okay. They may
yeah,
be putting out a thing
exactly.
that's okay. But I totally know what you mean. So one of the things that I often like to say is all emotional hyper overreactions are age regressions.
Yeah,
So there's a part of our brain called the insular cortex, which is very deep in the center
mhm,
of our brain.
yeah,
And it's kind of like the part of our brain that translates the mind to the body and the body to the mind. So
yes,
I believe this insular cortex, especially when we're younger, creates what I call an emotional signature of
yeah,
our trauma. So when, if you hear a car backfire or something like that, that insula will light up with that same emotional signature and will carry you back to that 7-year-old child. So when we have the wherewithal of a 7-year-old child, we're probably not going to make the best decisions.
no, no. It's unfortunate, but it's true. It's true,
So
and
what have you learned? How do you cope with something like this, Helen? Like I'm just kind of amazed by, your poise and the way you speak and how do you cope with something like that?
so, and again, I try as much as I can, and I really mean it, as much as I can, to be as honest as I can, as vulnerable as I can, and The second, because I look polished from outside. I'm an exec. I'm young, and I look like I have my act together. But the second I show that I am struggling because of because of my PTSD, because
Hmm.
of lack of safety, which happens to be the highlight of my experience living with trauma, people tend to get it. People are relating, and like you said, do they really feel safe, or are they acting it out? And I don't know, but a lot of people get some of the experiences that I share. How do I cope with it? I had an episode, for example, yesterday, when I feel in this state. I just have to keep myself anchored, and believe me, it's not easy. It's not
So how do
easy.
you do that? How do you keep yourself anchored, Helen?
Deep breath, deep breath,
Okay.
deep breath. And one thing I try to remind myself, that the whole world is rigged in my favor,
Hmm.
which is a very famous saying by Rumi. It's rigged in my favor. Everything is happening for me, not to me. I put my hand on my heart and I keep repeating deep breath after deep breath. And there are times it takes 10 minutes, takes 15 minutes, it takes 20 minutes. But I go outside for a run until I am able to get back to myself, and the triggers kind of go away, and the amygdala kind of calms down. But it's an excruciating pain to go through.
Hmm.
Yeah, and it happens often, even though I've done a lot of healing on myself. Yeah.
Yeah, like I said, when our nervous system gets forged in that, the other thing that I see with this type of trauma, and it's not, of course, as severe as war, but in families where there's alcoholism and
Yeah.
the person with the alcohol problem freaks out and causes all this damage within the household. So what'll happen is, this is the typical thing, is that the alcohol dependent person will get blind drunk, cause a huge upheaval in the household, and then they get very, typically, not always, then they get very apologetic. Things are okay for a while until the next blow up. So what the child's nervous system learns is, you can't trust safety because it's always going to get blown up.
Yeah.
So essentially, it's not safe to feel safe.
Yeah.
And which is, I think, what you're kind of describing to me, is it's just, for you, it doesn't feel safe to let your guard down and actually allow yourself to feel safe.
Yeah. Because it's short-lived.
Hmm.
Yeah, it's so true. It's so true. It's just like you're not allowing yourself to feel joy because something is about to happen, to rip that joy away from you, if that makes sense. The same exact feeling.
Oh, it totally makes sense. I mean,
Yeah.
on a smaller level, this is exactly what happens to people with anxiety,
Mhm.
that say weren't raised in a war zone, but, had a mother who kept saying to them, don't eat that or you'll get fat, or, a father who was physically abusive. And again, this is nothing compared to what war is, but for a child, it really does disturb the equilibrium that they need to develop a nervous system that builds some capacity and resilience. So it sounds like you've had to develop as much capacity and resilience as you possibly could as an adult.
Yeah. And it's a work in progress.
Of course it is.
It
Me
really is
too.
work in progress. It's There are days where I'm okay, and there are days where I'm not okay. And as much as I like to emphasize breath work and anchor, it's an effort. It's an effort.
Have
Yeah.
you ever done any sort of somatic work, Helen? Like, where they say, where do you feel that in your body? Where, like,
I have done
yeah,
EMDR, I have done somatic work, and I've done trauma informed, and I'm a trauma informed coach
right,
myself. It helps a lot, but and I know you know this, the second that amygdala goes nuts, no amount of logic helps.
totally.
And you're like, but I've gone through all this. It doesn't.
Yeah,
It's all like get
no.
thrown out of the window, right?
It's totally true, and the amygdala acts in different parts of the brain too. It stimulates the periaqueductal gray to create
Yeah.
endorphins and enkephalins. It's when we worry, we make the uncertain seem a little more certain, which to the
Yeah.
brain is a great thing. But when you think that the pain in your stomach is now, oh my God, is this stomach cancer like my uncle had? Then everything starts to cascade on itself. So it's really like, that's my kind of underlying theory of anxiety, and to some extent PTSD, because anxiety is really PTSD, is
Yeah.
that there is this alarm that's in our system, that's in our body, that's physiological. It's been programmed in there. And then there's the anxious thoughts of the mind. So the warnings, what ifs, worst case scenarios that our mind creates, what they energize each other. So the alarm in the body, the old childhood trauma that still, I call it background alarm in the book, that background alarm through this process we call interoception, because the mind is always reading the body. When it reads that trauma, it has to make up a story about that. And it's not going to make up a story of puppies, cookies, and picnics. It's going to make up a story of what happened to you, what was horrible. So we get into this alarm anxiety cycle. So I tell people that anxiety isn't one entity, but two. It's the anxious thoughts of the mind and this old trauma survival alarm energy that's held in the body. And they each energize the other. And once the thing starts going, it's very difficult to get out of it, because the worst part of it is it paralyzes your prefrontal cortex. It paralyzes your rational brain. So it drops you back into this emotional situation where you have the reasoning of a 7-year-old. And of course, you're not going to be able to. And then we get all this, positive self-help book about trying to think your way out of a feeling. And you can't do that because you're thinking, your rational brain has actually been taken offline. So now you're saying, well, you're supposed to think your way out of this. Well, this part of my brain has been shut off. It might as well have been stroked out because it's not available to me right now. So when you say you ground yourself, it's like what happens there is that we breathe, we put our hand on our chest, feet on the ground, whatever it is that we do. And then the body goes, okay, it's safe for the brain. The other thing that I like to do is tell people, can you expand your chest? So can you take a deep breath in and then breathe on top of that? And just keep breathing in, because when we expand our chest wall like that, and if we can hold it, it sends a message up to our brain that we're okay. And the thing that I will often combine with that, especially in the middle of the night, and I still do this, is, am I safe in this moment? Or I am safe in this moment. Because this moment is all we ever have. But what worries you, and I know I'm ranting and I'm going to stop in a second, but what worries do is they transport us emotionally into the future. And what trauma does is it transports us physically into the past. So if you can bring yourself, am I safe in this moment? Yeah, I'm worried about my dentist tomorrow. I'm worried about the tax bill that's coming up. I'm worried about the fight I'm having with my continuing fight that I'm having with my spouse. But is that happening right now, right at this minute? In this minute, are you actually safe? And a lot of people will reluctantly say, well, yeah, but, and I said, no, there's no but. All you have is this moment, right? And I know it sounds kind of like woo-woo and that kind of stuff, but all you have, and I think what we do as trauma survivors, and I feel so bad calling myself a trauma survivor when I'm faced with someone who's faced with war, but as what we do is we transport ourselves into what we know, because that's familiar. Right. And unfortunately, what we know is often more trauma.
No, I hear you. And it's been a daily labor of trying to bring yourself back. And I always say, an individual who has gone through trauma, be it a war, be it domestic violence, be it whatever it is, it's like a bird that just doesn't know how to perch for a while. They're constantly, going from one branch to a next. And the healing that these individuals need, at least that's how I feel, is to come back to myself. But the issue is we don't feel safe in our body.
Exactly.
And that is the problem. And you need to feel safe in your body. And time and again, I know people tell me that, perhaps I need to do my healing and then I can risk a relationship. And they tend to forget that healing from trauma, it comes with love and connection. It doesn't come before love and connection. You know what I mean?
Yes. Like the old saying is that your relationship with other people can be no greater than the relationship you have with yourself.
Yeah.
Right. So, and what Gordon Neufeld, who is my mentor in developmental psychology, used to say all the time is all anxiety is separation anxiety. And when we started talking today, being in a minority is by definition separating. By absolute definition, it's separating. So it's traumatic. It's anxiety provoking. Now, will all those people develop a state of alarm? Maybe not. But it certainly creates the substrate for that. And again, if you were born in this sensitive disposition, the odds that you're going to develop a nervous system that is sort of healthy, compliant, capable, resilient is less and less. And I love what you said about the perch, because it is that, like, you're flying around. It's like when a bird gets caught in the house, it's flying around. It can't land anywhere.
No.
So it's just freaking out, like hitting the walls and all that kind of thing. And it's such a, I'm going to steal that because it's such a good analogy. It's like you can't find a place to perch. right? And then the harder you try, the more you fly into the wall.
Exactly. And that's why I tell people the healing that these people want is not a disease, healing from a disease. They want to come back, but they just don't feel safe. They don't feel safe. And that is my personal experience of living with trauma. The other experience is that the restlessness that I'm constantly experiencing, the restlessness that I experience it's similar to a restlessness that an ADHD individual experiences, and it becomes excessive when I don't feel safe.
Mm-hmm.
When I don't feel safe, when I'm under pressure, when I'm like, oh my God, the world is about to come, after me, if that makes sense. Or if I come across a memory, let's say a war or an episode that is reminiscent of my past, I feel like I relive the whole episode all over again.
I
Now
think you do.
going back to the concept that you talked about minority and loneliness, one thing I'd like to share with you is that I grew up always feeling like I was the other
Mm.
Ration, because of my accent, because of my thick brows, because of the way I dressed, because of the way I looked. And people always treated me that I was different. They always categorized me as I was different from them. So I always feel like I was an outsider. I was an outlier. And I know they did not mean to hurt me, if that
Mm-hmm.
makes sense. But that is the subconscious, right? You don't look like the majority. And I grew up in the South, you know. I stood out like a sore thumb with my features, right? And
Right.
it creates that thing in you that perhaps you have to do something, to let go of. And I know Dr. Gabor Mate talks about authenticity and attachment a lot. There were times where I was subconsciously, I had to let go of things that made Helen who she is. So I could have friends, so I could have people to mingle with. And it was really difficult because I felt like I was always different, and that is why I couldn't be with XYZ, or I couldn't be in this group, or I couldn't be with this community, which was very, very difficult. And I think an average member of minority could relate to some of the experiences I'm sharing.
Yeah.
Yeah.
And I'll tell you that it's the different people that change the world.
Yeah.
It's a big price to pay.
Yeah, it is.
It's kind of, in a way, we're kind of like the sacrificial lambs of
Yeah.
the world,
Yeah.
but we move the world forward. And I think, and backward, trauma also moves us backward. I'm kind of hoping that it balances out in the positive direction. But yeah, it's the people who went through the trauma and are able to get out the other side and just express, okay, what has worked for me. And I think that's, my books and my program and that kind of thing is saying, okay, I went through all the traditional therapies. I went through
Yeah.
CBT, ACT, HIJK, LMNOP, you name it. I went through it all.
All
And
the letters. Yeah.
nothing really helped. Like it helped in the short term, it helps in the short term. And this is what happens in universities, is that they give people a CBT program and they give them an anxiety questionnaire when they start off, and it's like out of 100 for sake of argument.
Right. Right.
And they score like 80 when they first come in. So it's like, you're anxious, you're anxious. And then when they finish the 12-week CBT program, now it's down to 40. So now they say, well, this is evidence-based. But the problem is, your ego, what I call the ego dragon, the part of you that got incarnated when you were just a child to protect you from anything that's ever hurt you. It has this unrealistic goal of, if that hurt me in the past, we are never doing that again. This is what the ego dragon does.
Yeah.
So it prevents you from growth, right? It prevents you from healing because you can't dip your toe in the pain and then come back out of it again, which is, a lot of kind of what my wife Cynthia does, is takes people into the pain and then brings them back out again. And that's what I'll do with my anxiety people too, is I'll take them into the horrendous parts of their life. I haven't dealt with anybody with war, but and then I'll say, what was the best time in your life? So I'll ask you, what was the best time in your life, Helen?
I think the best time in my life when I felt safe in a community, in my tribe, if that makes sense. And
totally makes sense.
That tribe has narrowed over the years,
right?
Because of artificial intelligence, because of the people are preoccupied with the demand of the society, because of I don't know what, that circle has narrowed over the years, and it has gotten smaller and smaller. So I would say the best time is the time where I feel safe, which I really cherish. That is when I am in my tribe, where I feel myself authentic and psychologically safe.
Mm-hmm.
Yeah.
And is there a way of recreating that?
For sure, for sure. It's hard to find those people where you
Sure.
feel like you feel safe because you don't have a baseline for safety.
Yeah.
Because the child, you were so let down, right?
Yeah.
So that is something that I'm trying my best, if that makes sense. One thing I've kind of come to terms with is like, instead of having six, my tribe can be three.
Hmm.
It's not about quantity, it's about quality,
Right.
right?
Sure.
Having that one individual, and I know there are a lot of books on self-care. There's a lot of book on caring for others, but there isn't a lot of people on friends, having how to create good friends. Those are your tribes. There are times where you're just not comfortable to share your opinion with your significant other, even though your significant other was always there for you. But perhaps you need a friend to kind of like talk to. And the society doesn't teach us how the quality of friends, because those with quality friends are less likely to end up with depression, less likely
Hmm.
to end up with stress, and more likely to feel safe. Do you know what I mean? Because they have an outlet. They have an outlet to get the stress out of them. And I know that's something Oprah talks about, how she has PTSD, by the way, and I know you know that. But she
Mm.
says that she's never sought help from a therapist, because she would always, if something upset her, she would always pick up a phone and talk to her best friend. That is the power of friendship. Yeah.
It really is important. And I think on some level, though, I'm going to push back a little bit there in that our friends sometimes can be great sounding boards and
Yeah.
stuff, but that sometimes we can get the wrong advice from friends too. So
Mhm,
it's,
yeah.
having that professional kind of thing, not saying that professional therapists are 100% accurate or trustable and that kind of thing too. So it's the right therapist, like someone who feels right to you. I have a lot of people who in my anxiety sort of groups that go to cognitive therapists, talk
Yeah.
therapists, and it helps them for that week. And then the next week, they're back there talking about the exact same things again. So it's really important to have something that gets some traction with you, like what actually works. And one of the things that I find difficult is that we do couple trauma with security.
Yeah.
And that's what happens is that in that childlike brain, when we're forming these synapses, we couple trauma with security.
Yeah.
And so we will make our lives chaotic. We will take on too many things because when things get quiet, then the old stuff kind of hits us in the face. So we keep ourselves so busy, like that bird who can't find a perch, but it's familiar, right? Like that's one of the worst things about the way
That's
we're
home.
wired
Yeah.
as human beings is that we wire this familiarity with trauma. And I have like many a patient who said to me, Dr. Kennedy, frankly, I get worried when I'm not worrying. Right, like it's this, but it's not safe to feel safe, right? So it's the same, but it's familiar. Like there's almost like this thing, like, okay, well, I didn't die when I was 7, so it must have been okay. Like just this unconscious stuff that we get. We're so sensitive as human beings, and again, if we're born extra sensitive, it just makes it so much harder. And
Yeah.
again, I feel bad talking to someone, who had a grenade in their hand at 7 years old when, basically my dad would just, wind up going psychotic and wind up in the mental hospital. So again, it's sort of comparing one trauma to another, but
Well,
the root is still the same.
I think you make a very good point, though, is that, your trauma is very different than mine, which
Mm-hmm.
brings me back to this point that trauma is not limited to war. It really isn't. Yeah, war, it could be a bit more extreme, but like, you and I were talking about this before we went live, and is that for every combat veteran who gets deployed, there are 10 children in our back neighborhood who grew up in traumatic environments. And that's why the ACE study is so important, because
Mm-hmm.
it exposes you to other aspects of traumatic environments, sometimes not having an attachment and attunement from a caregiver, because a caregiver is so preoccupied with the demand of the society. According to, you mentioned Gordon Neufeld, which I'm crazy about his concept of, the 4 irreducible needs of a child. A lot
Mm-hmm.
of time when the child does not get the attachment and the attunement from a caregiver, could be traumatic. right? Could be
Totally.
traumatic. And they grew up that they grew up with that abandonment because they didn't get their attachment from a caregiver. So, and I'm really glad that you brought this up because it's important for the audience to understand that trauma is not limited to war. I mean, you
Yeah.
grew up with an individual who struggled with mental health disorder. There are others who grew up with a loved one struggling with addiction. I mean, there are so many aces out there. So I'm just so glad that we're talking about this.
Yeah, my thing about ACEs is really funny. So it's the Kaiser Permanente study of
Yeah,
1997, 57,000 people who were relatively, kind of well off because they were in
yeah,
this sort of cohort. And they measured what adverse childhood events that these people had. And the higher your adverse childhood event rating, the higher your chances of developing physical and emotional, diseases and that kind of thing too. And that was all the rage. And then the MDs in the early medical schools in the early 2000s started adopting this. Like, holy smokes, look at this! Look at what we found. And then you fast forward to about 15 years later, and half the medical students who are trained today don't even hear about ACEs. They don't even hear
no,
about that study. No, because, and this is the reason why, is because medical doctors are not trained in trauma. In
no,
fact, human beings are mind, body, and spirit.
yeah,
Now, medical doctors are okay at mind. They're pretty darn good at body, but
yeah,
they're terrible at spirit. And I love medical doctors. I think medical doctors are amazing. There's so many great things that comes out of medicine, and not just like acute trauma care and all that kind of stuff,
yeah, yeah,
but they're just terrible at spirit because we're not trained in it, for one. We don't have the time. I remember being in my clinic in Vancouver, because I used to live there in Vancouver, and this woman would come in on a semi-regular basis every sort of 3 to 6 months with a urinary tract infection. Now, my intuition, because I have this little spidey sense that I kind of have had since I was a child, told me that this woman was sexually abused. And that's one of the risk factors when you see someone with a multiple UTIs is sexually abused as a child. Now,
yeah,
one, I'm a man, so I can't really address that. But two,
yeah,
even if I could, that's an hour-long conversation, right? In a clinic where I'm seeing 30, 40, sometimes 50 people in a shift.
yeah,
So medical doctors were trained in this environment to give a prescription. And that's kind of how we do it, because we're not trained in like somatic therapy or how to show people how to feel safe in their bodies.
yeah,
And this is and medical doctors are great for some things, but this is where the narrow-mindedness comes in,
yeah,
where you get a prescription, and that's the gold standard, or CBT, or cognitive therapy. These are the
yeah,
gold standards for medical treatment, which don't work for the majority of people, but they have the illusion of working for the initially in the short term.
yeah,
So we just keep doing what we're trained to do, but we're not. And I think that's why, as an aside, I think that's why so many medical doctors and psychiatrists burn out, because they realize that just throwing medications at people isn't really helping them. Like, it's helping them cope, but it's not helping them really heal. And their job really isn't to help people heal, it's to help people cope. But refer to a somatic therapist, refer to an IFS therapist, refer to someone who does EMDR, refer to these people, because they will give this person another option. And perhaps the somatic work is so much more effective, probably likely, than whatever medication you would give them. I know that was a rant again, but
No,
that's how I feel.
I gave a talk to a group of doctors at John
Oh my
Hopkins,
God.
and it was called the medical round. And just
Right.
like you asked how like doctors don't get exposed to trauma, right? So I asked
Mm-hmm.
them, I was like, have you ever been exposed to trauma in your training? And one of them laughed at me and he said, Helen, what are you talking about? Our training is our source of trauma.
That's true.
Do you know what I
And
mean?
that is actually, but you're
Yeah,
trained as a medical doctor as a 20-year-old, not as
yeah,
a 7-year-old,
yeah,
right? Now, it's still horrendous. Like, I went
yeah.
through it. It's still pretty bad,
That's
being on
awful.
call for 36 hours at a
Yeah,
time. And, at the end, at hour 35, dealing with a cardiac arrest, like, your brain is just not
yeah,
working, right? So, and they're trying to fix that now. But yeah, it is traumatic. But the
it is.
difference, and I've heard that before, the difference that I say is, yeah, we're trained in our 20s, fine, but if you try to train a 7-year-old to be a doctor and say, hey, you got to be on call all night and you got to answer every possible call from every possible ward, that 7-year-old will be severely traumatized. I'm not
Yeah,
minimizing medical trauma or resident trauma or anything like that, But it is one of those things that there is a difference to being traumatized as an adult as opposed to being traumatized as a child.
Yeah, and the way I look at it is I don't like to talk about trauma in terms of big T and little T, and that's
Me either.
where I don't have trauma because it's not a big T. It doesn't fall in, says who. So I like to focus on trauma being an overwhelming experience.
Sure.
Now, what you just talked about with physicians and then their training, is it overwhelming for them? Probably.
Oh yeah.
Probably. It's
I can
too much.
guarantee you.
It's too much.
There's
It's too
doctors
fast.
have
And
the highest suicide rate of any profession
yeah.
that there is.
Oh, pharmacists
So
are right after you. Yeah.
they're getting there. They're getting
Yeah.
there.
Yeah. Pharmacists are after you.
Yeah. Yeah, it used to
It's
be dentists, and then
yeah.
pharmacists took over. Now doctors have been leading the way for a few years now.
Well, and the thing is, and I give a lot of talks on burnout because burnout is such a complicated
Sure.
concept, and people like to limit burnout to the workplace. I say burnout is a disease of civilization. It's the cost we pay
Yeah.
to live in a civilized society. Now, why do I say that? US takes a lot of pride in being civilized, and having technology, AI, and being an advanced country. But at what cost? At the cost of family, at the cost of community, and the cost of spirituality. Okay, which means masses of generations now are growing up deprived of attachment and attunement from a caregiver because mom and dad have to work. After
Totally.
30 days, 60 days, 90 days of delivery, that child gets dropped in daycare. That's why I'm not crazy about daycare, because if you look at the research, the child needs at least 9 months of attachment and attunement from a caregiver, and after 30 days, 60 days, 90 days, that child gets dropped in daycare. And the child interprets it as if I don't matter to my mother. They don't have that
Yeah.
cognitive, the rational part of the brain developed. It's not developed until they're like about 7, right? So when they grow up deprived of attachment and attunement, we've lost community, we've lost sense of family, and we've lost spirituality, which means now the Z generations and my generation, the millennials, are entering the workforce, expecting workforce to be the family that they've lost, the community that they've lost, and the spirituality. But work, end of the day, can only grant you an at-will employment.
Yeah.
It's not the boss's job to be your parent. It's not the
No.
boss's job to give you daily affection.
Well, that's
Okay?
one of the things that I see, in people who troll other people, like mental health, people who are trying to help.
Hmm.
All they're really doing is basically projecting their neglected parenting
Yeah.
onto other people, right? So I
Hmm.
have a friend who's in the personal help space, and he's very talented and very intuitive and that kind of thing, and he'll send me things saying, look, this couple thinks I'm amazing. I mean, paraphrasing a little bit, or
Right,
or
right.
this guy thinks I'm terrible. It's like all they're doing is projecting their bad parenting onto you. So don't take the accolades too deeply, but don't take the insults too deeply either, because it's not about you. It's
Yeah.
about the projection that they have on someone else, And the other thing about when you mentioned burnout, I think I heard this term somewhere. Burnout is a soul injury. And I
Yeah.
remember because I got out of medicine in 2013. So I've
Hmm.
been out of being a medical doctor for the last 10 or 11 years. And I remember at the time going, this is my identity. This is my identity as being a doctor.
Yeah.
So how could I have spent 10 years training for this job and
Yeah.
then wind up just hating it, right? So it's this like, I think there's part of us that says, why internally, why did you lead me down this path? Why did you make me work so hard
Hmm.
for something that you lied to me? I'm talking about myself,
Yeah.
was going to be this fulfilling, wonderful career, because it ain't. It's not. So I think there's that self-separation that comes from that, which is one of the biggest causes of alarm is separating from yourself.
Yeah.
And once you start doing that, I have this acronym I call JABS: judgment, abandonment, blame, and shame. So when we do that to ourselves, judge, abandon, blame, and shame ourselves, we separate even further from ourselves. We create even more alarm, which of course creates more anxiety, because as soon as you have the alarm in the system, it just, the brain just reads it and it just feeds you more and more warnings, what is worst case scenarios, to be consistent with this horrible feeling that's inside of your body. Now
Yeah.
that's magnified, 1,000-fold from war, but it's translatable to just trauma in general.
Yeah. No, I hear you. I hear you. And the other thing I'd like to talk about, especially in the field of medicine. Now, by medicine, I mean you, I mean pharmacists, I mean nurses, and I mean dentists. You guys all go into this profession with good intentions. Your number one priority is to provide care to the vulnerable, which is the sick, right? But the problem is the shift to value-based care has done a lot of great things. But at the same time, it has limited your knowledge, your expertise, your talent to a metric.
Patient connection, all that stuff.
Oh yeah, it comes at a cost. Like I said, everything comes at a cost. Everything. Value-based is good, but at what cost, right? Now, it doesn't matter how much you go above and beyond. Does it equal to the value that is defined by the third party claims, by the third party, which is the insurance, right? So a lot of time you feel like you cannot be yourself. Like a lot of my colleagues, because I'm a pharmacist, because of PBM, they are in communities, they're independent owners, they've inherited the business from their great grandparents because they're second, third generation pharmacists. They've provided for this individual in their community for years, and all of a sudden, because the insurance does not cover a medication because of a formulary BS, excuse my French.
No, I know where you're going. Keep going.
Imagine the moral injury that this individual, this provider is having to, and which is a form of a PTSD, is a form of trauma, moral injury. They have to tell this individual that they cared for years that I cannot provide care for you anymore because the insurance doesn't cover your medication. I mean, this is the value-based care that we're talking about here.
Yeah.
And people are like, I signed up to provide care. What am I doing here? Yeah.
Yeah, it reminds me again of the psychiatrists in a way. So in 2004, and I may got the statistics exactly right, but in 2004, 44% of active psychiatrists were providing psychotherapy.
Yeah.
So they do an hour with their client, patient, whatever you want to call them. In 2018, that had dropped to 21 or 22%. I don't remember the exact thing. And I'm sure now it's lower than that, because what you can do is you can do 3 20-minute medication reviews and get paid, for sake of argument, $600,
right?
As opposed to doing one patient service for 50 minutes and get paid $300. I'm just making the numbers up. I don't know what they are. So, the cash incentives, and I think I'll tell you from a medical point of view, as you're burning out, what you do, or what I did, was I started buying shit. I started buying stuff to make myself feel better.
Yeah.
Right. And then I had to see more patients because I had adopted this debt. So I was on this circle of buying stuff, going on trips, going on vacations, buying all this stuff. And then I had to pay for it by seeing more patients. So it just supersized that burnout. So I know where doctors are coming from. I know where it comes from. And I know the mentality of doctors, which is, you're on call for 36 hours. So the first 24 hours, you're not doing so good. And then that 12 hours later, you're going to get off call. But it's just waiting for those 12 hours to kind of tick by at the end. So you're always in this sort of state of limbo. Like, I don't like this, but I just have to endure it. So you get very resilient. They train you to become very resilient in residency. But the problem is, and as you say, and as Gordon Neufeld, because Cynthia and I both did a lot of training with Gordon Neufeld, and this is what Gordon says all the time, and you said it already today: at what cost? At what cost? Like that's how he says it. So Cynthia and I will say that to each other. Like when we have a client we're talking about, we'll say, at what cost?
Yeah.
Because that's what comes up.
It's everything. Like I tell people, everything comes at a cost, just like every downfall comes with gift and opportunity, right?
Yeah.
But the question is the cost worth it? Yes, it comes at a cost, but is it worth it? I can't answer for people.
Well, that's the frog in the boiling water situation too, right? Do you know that analogy?
I think so.
Okay, so basically, I mean, this is a parable. It's not supposed to be real, right? So you have a pot of boiling water, you throw a frog into it, he jumps out right away. You put a frog in warm water and you turn up the element, and it slowly raises up to boiling, and he stays there and dies because there was never a culmination point that said, this is terrible, I'm not doing this anymore. Yeah. And that's kind of, as human beings, that's kind of what we're like. It's one of the things that kind of disappoints me about human beings. Maybe that's not the right word, but is that they won't do anything about their mental situation until it gets so bad that
Yeah.
they have to, and then
Yeah.
they've been depleted so badly by the 6 to 8 months to a year to 5 years that they've been putting it off and putting it off and putting it off. They're so depleted that they don't have the resources or the energy to create that safety, that first step that allows them to actually heal.
Yeah. And I think that is the point I made. I was, talking to a group. Humans refuse to change until change becomes more painful than staying.
Yeah. Yeah, when
That's
the
what.
voice on the inside becomes louder than
Oh
the
yeah.
voice on the outside, like that's when we actually change, which is unfortunate, but it's just how we're like how we're wired. I'm not castigating people or calling them out for that. It's just that's how we are. And if you can recognize it a little earlier, perhaps you can be a little more proactive in that.
Yeah,
So
that's
in the
what.
last few minutes, Ellen, is there anything you want to touch on that we haven't touched on yet? This is fascinating.
I think it's, just, the whole awareness of, trauma. The fact now ACE is admitting that 70% of Americans, that 7 out of every 10 Americans are carrying with trauma. It means trauma shows up in our workplace, trauma shows up in our relationship, trauma shows up in our treatment to those under our care, trauma shows up in our relationship with those who are in our charge. And that is why it's important. It is important, and that is the focus of my third book, is to have a hard look at how the corporate world is treating employees. If 7 out of every 10 employees are carrying their unfinished childhood baggage and they're bringing their baggage into the workforce, right? It
Yeah.
is time for us to think that there is something we need to do about the workforce to make it trauma informed.
Yeah, let's hope, and I think that's or have faith. I'm a big proponent of faith over hope for so many ways,
Yeah,
but it reminds me of that story of the gazelle. The gazelle gets chased by the lion and
yeah,
it escapes and it shakes it out, right? Now, if that happened to a human, the human would just perseverate on
yeah,
that experience for the rest of their lives. So
yeah,
animals have this way of going through trauma and then shaking it out and then not having that cognitive kind of Ferris wheel thing going where they're just going over it in their mind over and over and over again. Eckhart Tolle talks about that in a book, A New Earth. It's one of my favorite passages from that book. On page 139, he talks about these two ducks that are in a pond, and one of the ducks swims up to the other one, and they get into a altercation, and then they turn around and they flap their wings and they just go the other way. Now, if that was humans, they'd be like, how dare he come in? This is my pond. Like, what is he doing coming over to my part of the pond? Like, and they would just focus on it and just ruminate on it. And that's what we do. Unfortunately, we're blessed with these huge prefrontal cortices that, build us rockets that go to the moon or beyond, if you
yeah,
believe in that stuff, and make Candy Crush and that kind of thing. But we can't just let it go. Like, we just
yeah.
can't do it. So
Yeah, my dogs do that too.
yeah,
Yeah, yeah, one of them walks onto the other and takes the bone, but they don't make a big deal.
yeah,
Life is good after all, right?
yeah. It's over. That's the thing.
It
It's
is.
over. It's over. That's the thing. And I think that, but they don't have the big prefrontal cortices that
No,
we
they
do,
don't. Dogs
right?
don't do it.
So it's like they live in the moment. And I think
Yeah,
and this is an off-topic thing too, but I think dogs don't feel pain the way that we do. I think dogs feel pain in the moment. They adapt to it because they're not constantly making it worse.
yeah,
When is this going to go away? I've had this for a while. Is this going to
yeah,
get worse? My
yeah,
grandmother had this arthritis. Am I going to be crippled? Like, am I going to be in a wheelchair? Like, it's just this cascade that starts that animals don't do. And it's like, can we get to the point where we move out of our heads and into our bodies? And that's what my latest book is about, is basically, I mean, the first, it's basically the second edition of the first book, which is
I've
when
read
you
your book,
get,
by the way. Yeah,
oh, thanks. Yeah. When
yeah,
you get alarmed or
yeah,
anxious, can you move into your body
yeah,
instead of staying in your head? Because your head is only going to make it worse, but your mind will tell you that it can fix it. It's like your mind will say, look, I can fix this feeling problem with more thinking.
yeah,
And considering anxiety is a problem of excessive thinking, adding more thinking into that isn't really going to make a difference, but we keep doing it. That's the thing. So I
Yeah.
think it's just understanding that, no, like I have this acronym ABC. So aware is awareness. What does anxiety feel like? What does alarm feel like in your body? Get used to it, understand where it comes from
Yeah.
so that you can recognize it early. Then go into your body and breath. That's B. So body and breath, get out of your head, what I call sensation without explanation, which is basically stay with the sensation. I know it's uncomfortable. I know you don't like it. But if every time you run out of that sensation into your mind, that sensation never gets metabolized. It'll always stay there or get worse. And the C is compassionate connection to the child in you. Like that's really, the crux of how we
Yeah.
maintain as much safety as we possibly can. Now, sometimes with traumas like war, we need help with that.
We do. We do. And it's a longitudinal effort. It's not like a one time and call it a day.
Yeah, absolutely.
And that's why I wish every politician would get exposed to the impact of trauma, so they would be very cautious about sending weapons to anywhere or endorsing war on any country. Just nothing good ever comes out of war. Nothing.
Yeah, I mean, I think it's just understanding that. Is there some like personal story or anything like that you want to close with about this kind of stuff? Because it's so sort of, talking before this was so meaningful for me to understand from an actual survivor standpoint.
Yeah. Well, if I may, and again, I am a war survivor. I am Muslim, but at a 7-year-old, I was dropped. I was brought to the U.S. A little later after the whole encounter with the Marine, and I was sponsored by a Jewish family. So this whole concept is not about being pro, Israel or pro-Palestine. This is about my concern with the whole situation of U.S. sending weapon. It's doing a disservice to Israel more than it's doing a disservice to Gaza. Now, why do I
Mm,
say that? Because war to me means trauma, and trauma means reenacting your trauma on the less vulnerable. So the more
right.
aggression, the more trauma. And the only way out of this whole tension in the Middle East, I think it's about diplomacy and communication and connecting to people. The Palestinians, they want to feel like they're being validated, their pain, their trauma to be seen and validated. Right. The Israelis at the same time, they need their loved one and their hostages back. But at the same time, the more US sends weapon and enforces this tension, the more the Israelis are going to get hurt, because
Right.
war is never an answer. And I say this because I'm a war survivor. I'm a member of minority, and I'm from Iraq, and have gone through war. And the only reason why I'm in the U.S. because of Operation Desert Storm. Okay, 2013, and how U.S. went into Iraq in my country because of weapon of mass destruction, which we all know was a big lie. There was no
Mm,
weapon of mass destruction, right? And what was the outcome? Thousands and thousands of children and kids got killed, and thousands of veterans returned home with a lot of trauma, who struggled in their marriages, in maintaining their job, and some of them are on the street as a homeless. So tell me, what good came out of this lie that the US used to go into a war in my country? So I just wanted to close that. Again, this is not about siding with anybody. This is just me saying I am not pro-war whatsoever, and sending weapons to anybody is never an answer to a solution.
yeah.
Yeah.
You're like pro-human is basically what I get
Exactly,
from you, for
exactly.
sure.
I care for Israelis just I care for Palestinian children, and I think everybody deserves a second chance because I've gone through it myself. Yeah.
Well, on that note, thank you, Helene June.
Thank you so much for having me. I really
And
enjoyed the conversation. I feel like I got healing from you. I feel like
nice.
I was
Yeah.
talking to my, therapist here. Yeah.
Yeah, I kind of seep into people that way. I think that's what happens. I just sort of slowly kind of come in
Yeah.
the back way and kind of help you understand a little bit better and just kind of ground me as much as I can. And I think I got that from my schizophrenic dad too. Like he had a real healing energy about him. And I think people who go through horrendous traumas, and both external and internal, because his internal trauma was absolutely horrendous,
Yeah.
there's something about them. I think that they have this ability, and I think and I say that in the book, I think one of the reasons why I was able to put out my books and my program and stuff is because he couldn't. I think he had the potential to do it, but his mind was so disturbed and so distraught and so disorganized that it kind of fell to me. And I appreciate it. If you said, could you live an anxiety-free life? 5 years ago, I probably would have said, yeah, I would have, just taken normal parents. But now I'm more like, no, as I've done more of my healing, it's like I know this is part of my own journey. And I think as we get farther from our traumas, it's kind of like childbirth. I've
Yeah.
delivered many, many babies. You wonder when you see women go through childbirth, it's like, and they say, I'm never doing this again. I've never, and I
Yeah.
was a family doctor. So I would see these women, 2 or 3 years later, pregnant again. It's like, are you really happy about this? Because I remember in
Yeah.
the operating room, you were like, I'm never doing this again. Like we would joke about it. Like I wouldn't say that to everybody, but if I had a really good relationship with my parents, like I remember, this, you were swearing that this is never happening again. And now
Yeah.
you're doing it again and you're happy about it. So I think there is that thing is like, can we learn how to be maybe not happy about it, but just not put that horrible kind of cognitive slush
Yeah.
crap that goes on top that just makes everything worse. So anyway, I could probably talk to you forever, Eileen. So
So I
so
just
uh
want to end this that
sure.
I'm a world traveler. I've been to more than 100 countries.
Wow.
I'm a solo traveler. And if you ask me, Helen, if you were to pick a one individual to accompany you in exploring the world with, I will tell you someone who has survived trauma. Now, why is that? Because there is so much wisdom. There is
Yeah.
so much wisdom that these individuals have acquired. There is no such thing as bad experience. There is learning in experience, and there is wisdom in bad experience. And what do I mean by bad experience? An overwhelming experience that is traumatic. There is so much growth and there is so much wisdom to be said about that. And I just love hanging out with those individuals. Yeah.
I remember one of my favorite comedians, Kevin Fox, he's still
Yeah.
out there um, doing comedy. I remember him saying that all comedians at one point were outsiders. And
Yes.
it's like
Yeah.
that's true. And I think what happens as an outsider is it makes you think about the world in a very different way. And I
Yeah.
think as an outsider, you start seeing, oh yeah, I'm an outsider. This is how I see the world, but this is how I think they see the world too. And
Yes.
I think when you bring those two things together, you have a chance in comedy, which sounds kind of trivial compared to like war, but in comedy, that's what we're doing is we're basically making something that doesn't make sense, or take something that does make sense and making it not make sense. Like, why do we do this? Like, this is crazy, which is
Yeah.
like sending weapons to kill other people, which doesn't help anybody.
No.
But again, I'm going to have to cut us off here because we're going to just talk forever.
Yes.
So, Aline, thank you. So how can people find you?
My website is helensairany.com. And I'm also on LinkedIn, Helen Sairany, and I'm on Facebook, Instagram, as well as, Twitter. So if people just search my name, they can find my website and find me on all social media. And my books, all 3 books are on Amazon in case if they're interested to learn about my story, my memoir, Trading Grenades for Candy. It has my picture with the Marine that saved my life, which I don't know who he is. I'm hoping to find him one of those days.
Oh,
And
wow.
it has also the book is dedicated to him, by the way. And it also has my other books on trauma. So if anybody's interested, my publications are all available on Amazon.
Awesome. Thanks so much for coming on the show, Aline.
Thank you so much for having me.
Bye for now.